There we're going to go more into mechanistically how does hypertension alters the neurovascular function, all right? Mainly neurovascular coupling and as well as endothelium-dependent relaxation and the whole thing that goes with the vessels. And there, the focus is going to be on the recent evidence showing that immune cells closely associated with the blood vessels called perivascular macrophages, which are a population of immune cells, innate immune cells, that is distinct from the macrophage coming from the bone marrow. And they're resident in other organs. So this is a complement of macrophages that you are essentially born with, all right? They come into the brain very early in development, like the microglia does, all right? Probably or presumably through a common precursor that then eventually leads to these different populations of microglia and then perivascular macrophages, meningeal macrophages, and choroplexus macrophages. So these are kind of the same family, I call them cousins, all right? Because they're not exactly identical, they're completely different transcriptomically and so on. So you can say that they're brothers and sisters, all right? They're more like cousins, and they populate the brain in different positions, and they have completely different function and completely different lifetime, all right? So the choroplexus macrophages and the one in the dura, they have a very rapid turnover. There's no blood-brain barrier in the choroplexus and in the dura, so the vessels can go in and out. The macrophage can go in and out. And so the macrophage go out, and the monocytes from the blood can come in and become macrophages, all right? But the perivascular macrophages and the microglia, they are self-renewing. They are not in exchange with the stuff that goes on in the blood, all right? So you essentially are stuck with whatever you got when they first got into the brain. We do not know if they divide, they die, and then they divide, whatever is left over divides, or if they may be precursors. That kind of nidus or precursor cell that keeps generating new cells, and then they eventually mature, they localize where they belong to, and they serve. So these cells, in the presence of vascular risk factors, they get very upset. They get very pro-inflammatory. Okay, they turn on their inflammatory pathways, and so they generate free radicals, they generate cytokines, and because they're so closely associated with the blood vessels, they diminish the function of the blood vessel. The vessels become less able to dilate and constrict, and because this ability is vital for the removal of the flow, because it's a pumping action of the vessel in the perivascular space that gets rid of the proteins that the brain produces, you end up getting more stuff stuck. So that's part of that neurovascular coupling thing. And what emerges from these studies is that although the brain is very much dependent upon oxygen and glucose provided by the blood, all right, the vessels do more than that. And so you may have alteration of the blood vessels, which have minimal effect on the ability of the vessels to deliver blood flow to the brain. But they can be nevertheless very pathogenic, perhaps affecting the clearance function, perhaps affecting the ability of the neurons to the homeostasis of the neurons, like in the case of that I was mentioning before of salt-induced hypertension and so on. So there is ways in which the vessel can still damage the brain, independent of whether the blood flow is getting there or not. Which is, I think, it's a very important concept, because today, over the past 100 years. The idea is that, the vessels can damage the brain by starving the brain. But that's not the only way that the vessel can do it. There is more than one way in which the vessel can damage. And so on. So we have to incorporate these new ideas into our clinical fields, all right? So we don't need to have vasodilators, to increase blood flow to the brain. We may need to have other things that may be cytokine-related approaches or so on, or inflammatory targeted approaches that affect the other functions of the vasculature, depending on what's the cause of the vascular dysfunction is. So vascular dysfunction is not one thing for every vascular risk factor. It is geared towards different vascular risk factors having different effects on the vessel.